This is Next Gen Nclex. Not practice, not review, not for beginners. In this video, you're facing 50 NGN case study questions designed to break pattern thinkers, expose weak clinical judgment, and punish guessing. If you get more than 10 correct, you're already operating at exam-ready nurse level. No pauses, no hints, no mercy. Let's see if you can think like the Nclex. Question 1. A 68-year-old client with a history of ischemic cardiomyopathy presents with acute dyspnea, orthopnea, and pink frothy sputum. SpO2 is 86% on room air. Which action should the nurse perform first? A. Administer IV furosemide. B. Apply high-flow oxygen. C. Obtain a stat chest X-ray. D. Insert a Foley catheter. Answer. B. Apply high-flow oxygen. Rationale. Airway and oxygenation take priority. Severe hypoxemia must be corrected before diuresis or diagnostics. Question 2. SATA. Which findings support the diagnosis of acute pulmonary edema? Select all that apply. A. S3 heart sound. B. Crackles in bilateral lung bases. C. Jugular vein distension. D. Dry mucous membranes. E. Pink frothy sputum. Answer. A. S3 heart sound. B. Crackles in bilateral lung bases. C. Jugular vein distension. E. Pink frothy sputum. Rationale. These findings indicate fluid overload and left ventricular failure. Dry mucous membranes suggest dehydration, not edema. Question 3. After IV furosemide administration, which assessment finding indicates the intervention is effective? A. Heart rate decreases from 110 BPM to 96 BPM. B. Urine output of 250 milliliters in 1 hour. C. Blood pressure drops from 150 over 90 to 118 over 76. D. Crackles persist but SpO2 improves. Answer. B. Urine output of 250 milliliters in 1 hour. Rationale. Increased urine output reflects effective diuresis, the primary goal of furosemide. Question 4. A client presents with chest pressure radiating to the left arm for 45 minutes. ECG shows ST elevation in leads 2, 3, and AVF. Which artery is most likely occluded? A. Left anterior descending. B. Right coronary artery. C. Circumflex artery. D. Left main coronary artery. Answer. B. Right coronary artery. Rationale. Inferior wall MIs, 2, 3, AVF, are commonly caused by right coronary artery occlusion. Question 5. SATA. Which medications should the nurse anticipate administering immediately? Select all that apply. A. Aspirin. B. Morphine. C. Nitroglycerin. D. Alteplase. E. Metoprolol. Answer. A. Aspirin. C. Nitroglycerin. E. Metoprolol. Rationale. Morphine is reserved for refractory pain after nitrates. NGN expects aspirin plus nitrates as immediate core therapy. Question 6. The client becomes hypotensive after nitroglycerin administration. What is the most likely cause? A. Right ventricular infarction. B. Allergic reaction. C. Coronary artery spasm. D. Excessive beta blockade. Answer. A. Right ventricular infarction. Rationale. Inferior MI may involve the right ventricle, which is preload dependent. Nitrates reduce preload and cause hypotension. Question 7. A client arrives 2 hours after sudden onset of right-sided weakness and slurred speech. Which action has the highest priority? A. Obtain consent for thrombolysis. B. perform NIH stroke scale. C. Check blood glucose. D. Start IV normal saline. Answer C. Check blood glucose. Rationale. Hypoglycemia can mimic stroke and must be ruled out before further interventions. Question 8. SATA. Which findings would exclude the client from receiving TPA? Select all that apply. A. Blood pressure 198/112 millimeters mercury. B. Platelet count 85,000 per millimeter cubed. C. Symptom onset 2 hours ago. D. History of intracranial hemorrhage. E. Blood glucose 62 milligrams per deciliter. Answers. A. Blood pressure 198/112 millimeters mercury. B. Platelet count 85,000 per millimeter cubed. D. History of intracranial hemorrhage. Rationale. Severe hypertension, thrombocytopenia, and prior intracranial bleed contraindicate thrombolytic therapy. Question 10. SATA. Which ABG findings are expected with an acute pulmonary embolism? Select all that apply. A. Respiratory alkalosis. B. Decreased PaO2. E. Hypoxemia. Answers. A. Respiratory alkalosis. B. Decreased PaO2. E. Hypoxemia. Rationale. Hyperventilation causes respiratory alkalosis. Ventilation-perfusion mismatch leads to hypoxemia. Question 11. A client with pneumonia has a lactate level of 4.6 millimole per liter, BP 86/50, HR 128. What does this most indicate? A. Septic shock. B. Severe dehydration. C. Cardiogenic shock. D. Respiratory failure. Answer. A. Septic shock. Rationale. Elevated lactate and hypotension despite infection indicate septic shock. Question 12. Which intervention should be initiated first? A. Vasopressors. B. Broad-spectrum antibiotics. C. Blood transfusion. D. Mechanical ventilation. Answer. B. Broad-spectrum antibiotics. Rationale. Early antibiotic administration within 1 hour is the strongest predictor of survival in sepsis. Question 13. A client with type 1 diabetes presents with fruity breath, Q-small respirations, and glucose 620 milligrams per deciliter. Which IV fluid is initiated first? A. D5 1/2 NS. B. 0.9% normal saline. C. Lactated ringers. D. 3% saline. Answer. B. 0.9% normal saline. Rationale. Isotonic fluids restore intravascular volume before insulin or dextrose. Question 14. SATA. Which findings confirm diabetic ketoacidosis? Select all that apply. A. Metabolic acidosis. B. Elevated ketones. C. Hyperglycemia. D. Hypernatremia. E. Low bicarbonate. Answers. A. Metabolic acidosis. B. Elevated ketones. C. Hyperglycemia. E. Low bicarbonate. Rationale. DKA is characterized by metabolic acidosis, ketones, hyperglycemia, and low bicarbonate. Question 15. A provider orders potassium chloride IV push for a client with hypokalemia. What should the nurse do? A. Administer slowly over 5 minutes. B. Dilute in normal saline. C. Question the order. D. Verify cardiac rhythm. Answer: C. Question the order. Rationale: potassium must never be given IV push due to risk of fatal dysrhythmias.
Question 16. Which assessment finding most suggests increased intracranial pressure? A. Tachycardia. B. Narrow pulse pressure. C. Bradycardia. D. Hypotension. Answer: C. Bradycardia. Cushing's triad includes bradycardia, widened pulse pressure, and irregular respirations. Question 17. SATA. Which nursing interventions reduce intracranial pressure? Select all that apply. A. Elevate head of bed 30 degrees. B. Maintain neutral neck alignment. C. Hyperventilate routinely. D. Avoid suctioning. E. Administer osmotic diuretics. Answer: A. Elevate head of bed 30 degrees. B. Maintain neutral neck alignment. E. Administer osmotic diuretics. Rationale: these interventions promote venous drainage and reduce cerebral edema. Routine hyperventilation is avoided. Question 18. 10 minutes into a blood transfusion, the client develops fever, chills, and flank pain. What is the first action? A. Slow the infusion. B. Stop the transfusion. C. Administer acetaminophen. D. Notify the provider. Answer: B. Stop the transfusion. Rationale: suspected acute hemolytic reaction requires immediate cessation of transfusion. Question 19. Which client should the nurse assess first? A. COPD client with SpO2 90% on 2 liters. B. Post-op client with urine output 20 milliliters an hour. C. Diabetic client with glucose 280 milligrams per deciliter. D. Client with chronic atrial fibrillation, HR 92. Answer: B. Post-op client with urine output 20 milliliters an hour. Rationale: oliguria post-op suggests possible hypovolemia or acute kidney injury and is immediately life-threatening. Question 22. A ventilated client suddenly becomes agitated. Peak airway pressures increase from 22 to 40 centimeters of H2O. SpO2 drops to 84%. Breath sounds are diminished on the right. What is the most likely cause? A. Pulmonary embolism. B. Ventilator-associated pneumonia. C. Right-sided pneumothorax. D. Acute respiratory distress syndrome. Answer: C. Right-sided pneumothorax. Rationale: sudden hypoxia, unilateral breath sounds, and increased airway pressure indicate pneumothorax. Question 21. SATA. Which immediate actions should the nurse take? Select all that apply. A. Disconnect from ventilator. B. Administer 100% oxygen. C. Prepare for chest tube insertion. D. Suction the endotracheal tube. E. Assess tracheal deviation. Answer: B. Administer 100% oxygen. C. Prepare for chest tube insertion. E. Assess tracheal deviation. Rationale: pneumothorax requires oxygen support and rapid decompression. Suctioning worsens pressure. Question 22. A client has continuous tonic-clonic seizures lasting 7 minutes. Which medication is the priority? A. Phenytoin. B. Lorazepam. C. Phenobarbital. D. Valproic acid. Answer: B. Lorazepam. Rationale: benzodiazepines are first line for active seizures due to rapid onset. Question 23. After seizure cessation, which finding requires immediate intervention? A. Post-ictal confusion. B. Respiratory rate 8 minutes. C. Blood glucose 140 milligrams per deciliter. D. Headache. Answer B. Respiratory rate 8 minutes. Rationale. Respiratory depression from benzodiazepines is life-threatening. Question 24. A client's creatinine rises from 1.0 to 2.8 milligrams per deciliter in 24 hours. Urine sodium is elevated. What type of AKI is most likely? A. Prerenal. B. Intrarenal. C. Postrenal. D. Chronic kidney disease. Answer B. Intrarenal. Rationale. Elevated urine sodium indicates intrinsic renal damage. Question 25. SATA. Which findings support intrarenal acute kidney injury? Select all that apply. A. Muddy brown casts. B. Fractional excretion of sodium greater than 2%. C. Dehydration. D. Nephrotoxic drug exposure. Answer A. Muddy brown casts. B. Fractional excretion of sodium greater than 2%. D. Nephrotoxic drug exposure. Rationale. Tubular injury causes casts, sodium wasting, and is often drug-induced.
Question 26. ABG results. pH 7.28, PaCO2 30, HCO3- 14. How should this be interpreted? A. Metabolic acidosis with respiratory compensation. B. Respiratory alkalosis. C. Mixed acidosis. D. Metabolic alkalosis. Answer A. Metabolic acidosis with respiratory compensation. Rationale. Low pH and bicarbonate with compensatory low CO2. Question 27. Which clinical condition most likely caused this ABG pattern? A. Vomiting. B. Diarrhea. C. COPD exacerbation. D. Anxiety. Answer B. Diarrhea. Rationale. Diarrhea causes bicarbonate loss, metabolic acidosis.
Question 28. A telemetry monitor shows chaotic, irregular waves with no identifiable QRS complexes. The client is unresponsive and pulseless. What is the first action? A. Administer amiodarone. B. Defibrillate immediately. C. Start CPR. D. Give epinephrine. Answer B. Defibrillate immediately. Rationale. Ventricular fibrillation requires immediate defibrillation. Question 29. After defibrillation, which medication is given if rhythm persists? A. Atropine. B. Lidocaine. C. Amiodarone. D. Adenosine. Answer C. Amiodarone. Rationale. Amiodarone is indicated for refractory ventricular arrhythmias. Question 30. A client with a C5 spinal cord injury develops hypotension, bradycardia, and warm, dry skin. What is the most likely cause? A. Hypovolemic shock. B. Neurogenic shock. C. Septic shock. D. Cardiogenic shock. Answer B. Neurogenic shock. Rationale. Loss of sympathetic tone causes hypotension and bradycardia. Question 31. SATA. Which interventions are appropriate? Select all that apply. A. IV fluids. B. Vasopressors. C. Trendelenburg position. D. Atropine. E. Diuretics. Answer A. IV fluids. B. Vasopressors. D. Atropine.
Rationale: support perfusion and heart rate. Diuretics worsen hypotension. Question 32. A client states, "Everyone would be better off without me." What is the nurse's best response? A. You shouldn't think like that. B. Why do you feel this way? C. Are you thinking about harming yourself? D. Things will get better. Answer: C. Are you thinking about harming yourself? Rationale: direct assessment of safety is required. Question 33. Which intervention has the highest priority? A. Initiate one-to-one observation. B. Notify the provider. C. Administer antidepressants. D. Encourage journaling. Answer: A. Initiate one-to-one observation. Rationale: immediate safety outweighs all other interventions. Question 34. A 2-year-old with bronchiolitis has nasal flaring, retractions, and RR 60 per minute. What indicates impending respiratory failure? A. Wheezing. B. Tachypnea. C. Diminished breath sounds. D. Cough. Answer: C. Diminished breath sounds. Rationale: decreased breath sounds signal exhaustion and failure. Question 35. SATA. Which interventions are appropriate? Select all that apply. A. High-flow nasal cannula. B. Chest physiotherapy. C. Intubation preparation. D. Oral fluids. E. Continuous pulse oximetry. Answer: A. High-flow nasal cannula. C. Intubation preparation. E. Continuous pulse oximetry. Rationale: airway support and monitoring are priorities.
Question 36. A postpartum client suddenly develops severe uterine bleeding. Fundus is boggy. What is the first action? A. Administer oxytocin. B. Notify the provider. C. Perform fundal massage. D. Obtain blood products. Answer is C. Perform fundal massage. Rationale: uterine atony is treated immediately with massage. Question 37. Bleeding continues despite massage and oxytocin. What is next? A. Methylergonovine. B. Hysterectomy. C. Tranexamic acid. D. Misoprostol. Answer is A. Methylergonovine. Rationale: second-line uterotonic if no contraindications. Question 38. Heparin infusion is ordered at 18 units per kilogram per hour. Client weighs 70 kilograms. How many units per hour should the nurse administer? A. 980. B. 1,120. C. 1,260. D. 1,400. Answer is C. 1,260. Rationale: 18 times 70 is equal to 1,260 units per hour. Question 39. APTT result returns at 120 seconds. What is the nurse's best action? A. Increase infusion. B. Stop infusion. C. Decrease infusion. D. Administer protamine. Answer is B. Stop infusion. Rationale: critically high APTT requires stopping infusion immediately. Question 40. A competent client refuses life-saving treatment. What should the nurse do? A. Notify ethics committee. B. Administer treatment anyway. C. Respect the refusal. D. Ask family to decide. Answer is C. Respect the refusal. Rationale: competent clients have the right to refuse treatment. Question 41. Which client requires immediate intervention? A. DKA client with K plus 3.1 milliequivalents per liter. B. GI bleed with BP 88/54. C.
asthma with wheezing, D. CHF with 2+ edema. Answer is B. GI bleed with BP 88/54. Rationale: active hemorrhage with hypotension is immediately life-threatening.
Question 42. Which trend most indicates deterioration? A. HR 92/104. B. BP 118/76 to 110/70. C. Urine output 40 to 18 milliliters per hour. D. Temp 37.8 to 38.2 degrees Celsius. Answer: C. Urine output 40 to 18 milliliters per hour. Rationale: oliguria signals organ hypoperfusion. Question 43. A ventilator's low pressure alarm is sounding. What is the most likely cause? A. Kinked tubing. B. Pneumothorax. C. Disconnected tubing. D. Secretions. Answer: C. Disconnected tubing. Rationale: low pressure indicates air leak or disconnection. Question 44. SATA. Which findings indicate worsening sepsis? Select all that apply. A. Rising lactate. B. Decreasing urine output. C. Bradycardia. D. Altered mental status. E. Hypertension. Answer: A. Rising lactate. B. Decreasing urine output. D. Altered mental status. Rationale: organ dysfunction and hypoperfusion define sepsis progression. Question 45. Which order should the nurse question? A. 30 milliliters per kilogram IV fluids. B. Broad-spectrum antibiotics. C. Acetaminophen PRN. D. Delay antibiotics until cultures return. Answer: D. Delay antibiotics until cultures return. Rationale: antibiotics must not be delayed in sepsis. Question 46. Which outcome best indicates improvement? A. Decreasing temperature. B. MAP greater than 65 millimeters mercury. C. WBC trending down. D. HR less than 100. Answer: B. MAP greater than 65 millimeters mercury. Rationale: adequate perfusion pressure is the primary goal. Question 47. A client suddenly becomes confused and restless. SpO2 is 89%. What is the priority action? A. Apply oxygen. B. Reorient client. C. Draw ABGs. D. Notify provider. Answer A. Apply oxygen. Rationale: hypoxia must be corrected immediately. Question 48. Which task can be delegated to an unlicensed assistive personnel? A. Assess pain. B. Measure urine output. C. Titrate IV drip. D. Interpret ECG. Answer B. Measure urine output. Rationale: UAPs can collect data, not assess or interpret. Question 49. Which client is safe for discharge? A. CHF client with new crackles. B. Asthma client using accessory muscles. C. DKA client with closed anion gap. D. Stroke client with dysphagia. Answer C. DKA client with closed anion gap. Rationale: resolution of anion gap indicates DKA recovery. Question 50. What is the primary goal of NGN case studies? A. Test memorization. B. Identify medical diagnoses. C. Evaluate clinical judgment. D. Replace Nclex RN. Answer C. Evaluate clinical judgment. Rationale: NGN focuses on recognizing cues, prioritizing actions, and evaluating outcomes. Fast. If this video humbled you, good.
That's exactly what Next-Gen Nclex is designed to do. Passing NGN isn't about memorizing facts. It's about recognizing cues, prioritizing actions, and evaluating outcomes fast. Drop your score in the comments. If you got under 10, you're normal. If you got over 15, you're dangerous. Subscribe to MCQs Master 101, because easy questions don't pass hard exams. I'll see you in the next case study.